Coming up on Mountain News this morning, as COVID-19 deaths hit 275 in Kentucky and 71,000 in the United States, some ask if states are reopening too soon. And despite a startling number of new cases announced in Kentucky yesterday, there are some signs that we may have avoided a surge in COVID-19 patients.
Dedicated to Eastern and Southern Kentucky, this is WYMT Mountain News This Morning.
Good morning, I'm Katie Cook. It is Wednesday, May 6th, and the time is about 5 o'clock this morning. Let's check in with Brandon Robinson for a look at your forecast. Brandon, are we going to see as much rain today as we did yesterday?
I hope not, because yesterday the morning was kind of crazy. We're going to continue to see the possibilities for some rain, though, in scattered form. You take a look at live pinpoint Doppler radar, and it's mainly off to our west at the moment. We're going to take a little scoot to the west there. You can see it a little bit better there, and some out there, but again, scattered is the word of the day today. Let's take a look at our temperatures this morning, and they are pretty mild as we head out the door, but a little cooler than they have been. We're in the 40s this morning in a lot of locations there. 48 and 47 is a popular number this morning there across parts of the region, so a little extra maybe on your coffee meter, not because it's that cold, because the temperatures are not going to move that much today. I'd say we top out in the low 50s at best there, so again, it's just going to be one of those days that it's going to be chilly and kind of dreary. Now the skies did clear out in some locations overnight, so you could see a little bit of sunlight to start the day in some areas. Don't count on that lasting, because as those scattered shower chances come in, the clouds will pick back up and they may not even clear until later this evening, which could give way to another interesting thing tonight, possibility for frost. We'll talk more about that coming up here in a few minutes. Katie?
All right, thank you, Brandon. Well, Governor Andy Beshear announced the largest one-day increase in COVID-19 cases in Kentucky last night. 625 new cases were announced, 309 of them at the Green River Correctional Complex in western Kentucky. Kentucky now has at least 5,822 cases. 14 new deaths were also reported, bringing the death toll to 275, 152 of those at long-term care facilities. And COVID-19 has especially been hard for people in nursing homes. As you saw just now, about half of the deaths in the states are linked to long-term care facilities. We talked to Governor Beshear yesterday and asked him if he could see a time later this year when people could visit their loved ones face to face.
By the end of the year, do I believe that we'll have some form of limited visitation? Yes. But in this first stage of reopening the economy, we're all going to go from, in me and my family, a set of 4 contacts to a set of 30 or 40-something contacts, which means that then going to one of those facilities might even be a little more dangerous. So we got to keep making sure that we protect those around us, but we also got to make sure that we have ways to connect with parents and grandparents that are in those facilities.
One of the hardest hit nursing homes in the state is Jackson Manor. Health officials reported 2 more deaths yesterday, both women. One is 70 years old and the other is 95. That brings the total deaths at Jackson Manor to 11. At least 53 cases of COVID-19 have also been connected to the nursing home. Shaping Our Appalachian Region held a Zoom call with health officials yesterday. Dr. Margot Riggs with the CDC and Scott Lockard with the Kentucky River District Health Department joined SOAR Executive Director Jared Arnett on the call. The 3 talked about how COVID-19 is being handled in the region and what still needs to be done. The hour-long conversation ended with a brief question and answer session for businesses.
And again, kudos to our State Department of Public Health and this administration. Everybody is working together. This is something new for us. You know, since 1918, the Spanish influenza, we've not seen anything like this. So none of us that are working today lived through that. So obviously it's new territory. All of us just working together, being patient, and we're going to get back where we need to be.
If you missed the discussion, you can watch it on SOAR's YouTube page. Yesterday was the first day of Pikeville Medical Center's drive-through testing in the lot near the former Jerry's restaurant. Testing began at 8 o'clock in the morning and continued until 70 tests were completed, which was around 1:30 yesterday afternoon. The testing site is open to anyone who needs a test, no registration or doctor's order required, and will remain open from 8 until 4 or until they run out of tests Tuesday through Friday for the foreseeable future. And despite last night's higher numbers, a sign Kentucky may have avoided a surge in COVID-19 patients is that the Nutter Fieldhouse Hospital is likely coming down soon. UK Healthcare says the makeshift hospital may no longer be needed. 400 beds were brought into the football practice facility to house patients, but UK says they have a surge capacity of up to 1,300 beds to handle COVID-19 patients. It's not clear when the makeshift hospital could come down. But as places begin to reopen, health experts say it's important to still take precautions in public to continue this progress. This as Kentucky prepares to enter phase 1 of reopening the state for business. Health experts say it's important that the public does their part in preventing the spread of the virus, comparing things like wearing a mask and washing your hands to putting on a seatbelt, a safety measure that can save lives. Dr. Ryan Stanton is concerned about the impact of those who are not taking warnings seriously.
We have to maintain those freedoms, but at the same time, we have to be smart as well. Because the virus doesn't care what country you're from. It doesn't care who you are, your political party. It doesn't care about any of that stuff. All it cares about is its next host that it can get into and infect.
Even with these measures, many health experts now believe the number of cases in America will continue to rise through summer. Barbers, cosmetologists, and other similar professions will soon be able to go back to work. The Kentucky Board of Cosmetology has drafted about 6 pages worth of recommendations before the May 25th opening. For one, the board is recommending that salons go by appointments only, scheduling clients either over the phone or online. If that's not possible, the board suggests having a check-in system. They also advise all capes and tools be either discarded or disinfected between each use. Well, thank you for getting your day started with us here on Mountain News this morning. Coming up, anyone who has been to a medical office knows how important the work of a nurse is. We'll show you why now is the time many are stepping up to honor that work.
A fairly gloomy and kind of quiet day for the most part. It's going to be cool too. We'll talk about when some bright spots can return to the forecast in about 3 minutes.